Hello, Mr. Schmidt. What brought you back? I came back because the site of the injection itches, and I seem to have developed a cough, and I feel very faint. And I have cold sweats. Mr. Schmidt, I'm afraid you're having an allergic reaction. Hi everyone, it's bilingual Dr. Joey. This episode is created based on a true story as myself as a patient having an anaphylactic reaction, as well as my personal experience as a doctor. However, this is purely a language education video intended to teach you some vocabulary necessary in a situation similar to the one presented. And this is not medical advice by any means. It's purely for education. So if you have any concerns, please consult a medical profession and don't base your actions solely on this video. I hope you learn all the necessary vocabulary in Japanese and also in English to communicate in such a situation. And I hope you never, ever experience an anaphylactic reaction yourself.
This first video will only be in English.
I hope you enjoyed this episode.
Let's dive right back in.
Mr. Schmidt, I'm afraid you're having an allergic reaction. Have you had such a reaction before? Okay, no, so you don't have an EpiPen on you. Okay, I've already called
The
in-hospital team that can help you immediately in such a situation. Okay, can you please lie down here?
On the gurney?
I'm going to take your vitals. Sure, I'm going to check your blood pressure, your heart rate.
Listen to your breath sounds and measure the amount of oxygen in your blood with this machine.
Do you have any trouble breathing or feel like your tongue is swelling up? Actually, I do have a little trouble breathing. It feels like there's higher resistance. I feel maybe a little bit out of breath.
It's not that I can't breathe, but
it's strenuous to breathe.
Mr. Schmidt, I'm going to lift the head of the gurney up so you can breathe easier, okay?
Let me start you on oxygen and administer adrenaline into your thigh muscle. This is going to hurt, but it should make you feel better, okay? And we're going to place an IV line so we can give you some infusions. Do you have any chest pain? No, I don't have chest pains, but
I already feel much better.
My heart is beating so fast, it feels like I'm gonna vomit my heart out.
Do you have any
gastrointestinal symptoms like nausea, vomiting,
severe abdominal pain,
or diarrhea? Yes, actually, I have vomited at the toilet right before I came here, and I
also had
diarrhea at the time. Doctor, actually, I can't breathe. It feels like I'm drowning. I can't breathe out, and even when I do, it feels like I just can't get the air out. Mr. Schmidt, let me give you some inhalation medication. Please breathe through this tube. This also has oxygen, so it's supposed to make your breathing feel a little better. I'm going to administer some adrenaline into your thigh muscle, okay? I feel like I might actually die. I don't think I'm gonna...
Just then, the resuscitation team arrives with all the equipment. Typically, an EpiPen gives almost immediate relief, and most cases aren't complicated. If you feel you have anaphylaxis, please administer the EpiPen as instructed by your physician. Alert everyone around you and call the ambulance as soon as possible. I know this must have been a lot to take in. The next video will have subtitles in Japanese and we'll go over all the terms that came up in this video. Thank you for watching! Please like and subscribe. いいね、チャンネル登録よろしくお願いします。Ciao, ciao, bye bye, have a nice day!